Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 8, Episode 3 of the Function with Purpose podcast. Thanks for joining in with me today, whether you're driving in the car, maybe you're working on the computer. Hopefully you have some coffee in hand. I just finished some coffee. I like to drink my coffee in the morning. So this is the morning as I'm recording this. So, okay. A topic I think that people don't, necessarily consider this a part of their recovery process, especially if one has underwent a surgical procedure. And in this case, because this is primarily based on physical therapy, a orthopaedic neuromuscular surgery. So anywhere from perhaps a rotator cuff repair to a hip replacement, knee replacement, or meniscus repair to an ankle fusion. So more on the orthopedic end. So respecting the meds or medications after surgery. That is totally a thing. There is a reason why the tending surgeon prescribes medicine to help with pain, to help with function, to help with sleep, especially when one undergoes an orthopedic surgery. So, just a little bit of a background here on medications. I'm just going to kind of quickly go through this. So I remember when we were in physical therapy school, we had to learn these different drug schedules, meaning there's kind of like 5 main drug schedules. I had to relook this up because it's been quite some time. So there's level or schedule 1, schedule 2, schedule 3, 4, and 5 classes of drugs. Schedule 1 is the most controlled drug out there. Schedule 1 drugs or substances or chemicals are defined as drugs with no currently accepted medical use in a high potential for abuse. Examples of this is heroin, marijuana, kind of along that spectrum. So think of some old school movies that we used to watch growing up. People literally shooting up in their vein these very bad drugs. Next in kin, Schedule 2 drugs or substances or chemicals are defined as drugs with a high potential for abuse, with use potentially leading to severe psychological or physical dependence. So some examples of these are Vicodin, cocaine, Oxycontin, etc. Now, there are those type of drugs have to be prescribed, right? Because it's very common that patients who undergo surgery, now we're talking orthopedic surgery, are prescribed Vicodin, are prescribed Oxy, but it's more of a mixture of Tylenol and ibuprofen. So these are prescribed to an extent, but they are monitored. And then we have Class 3 or Schedule 3 drugs or substances or chemicals that are defined as drugs with a moderate to low potential for physical and psychological dependence. So these examples are Tylenol with codeine, testosterone, anabolic steroids. And then we go down to Class 4 or Schedule 4 drugs, which have a lower potential for abuse and low risk for dependence. And those examples are Xanax, Tramadol, Valium, Ativan. And then lastly, our Schedule 5 drugs or substances are defined as drugs with lowest potential. And they consist of preparations containing limited quantities of certain narcotics. So some examples of these are Lyrica, Robitussin AC, Modafin, which is actually prescribed for diarrhea. But in this case, post-surgery, we have to respect the medicine or medication that is prescribed, typically orally, in a pill form. When prescriptions are utilized, especially post-surgery, that the prescription is in a safe level for appropriate recovery purposes. So you're not really going to get addicted to this medicine because the tending physician or surgeon has to know the levels on which to prescribe the medicine. So from the physical therapy perspective, we do vouch for respecting the medicine because it's a part of the healing process. And from the physical therapy point of view, if someone comes in with a knee replacement and it's hard for them to maneuver, it's hard for them to bend their knee, and they have taken zero pain medicine to help lower that pain threshold so that they can actually tolerate moving, then that physical therapy session will be highly difficult to undergo, right? Because when someone comes in with a knee replacement, our goal is to regain range of motion back. It's not comfortable. And we have to utilize some heavy manual therapy, especially early on in the process. So it's very important that respecting the medication, planning your day around physical therapy when you're in rehabilitation, that perhaps taking your medicine before physical therapy so that way your physical therapy session can have more purpose. You can feel the benefits of regaining that range of motion back. Then you might have to, per physician or surgeon order, that you might have to take some medicine after, right? Because after we move that knee around and do some hands-on work and then back it up with therapeutic exercise, that knee is going to be super sore. So it's all a part of the healing process, right? And then in turn, respecting the meds after surgery, especially, medicine or medication is prescribed for a certain amount at a certain quantity at certain dosages and milligrams. And that is based on how it's taken per day. Maybe it's 3 times a day. Maybe it's 2 a day. Maybe it's 1 a day. Again, disclaimer, a physical therapist cannot prescribe oral medication to patients. That is out of our scope of practice. We do, when we are in physical therapy school, we do need to know some basics of the types of medications that are commonly prescribed to patients. And right off the bat, Tramadol, Meloxicam, Oxy. I don't think they do Oxy as much, but hydrocodone, Xanax. So those are those like Schedule 4, sometimes up to Schedule 2 drugs. But again, it's at respective milligrams or dosages. So yes, that is totally a thing. Respecting the meds, especially after surgery. I don't really I don't really agree when patients undergo a surgery and literally like the day or two after they're like, yeah, I quit taking my pain medicine, but man, my shoulder's killing me. I just try not to put that stuff in my system. And I get it. I understand. But it is a part of the healing process, because if you come in with a rotator cuff repair, our goal is to get as hands-on as quickly as possible to passively move that shoulder around. And if you can't tolerate that because of pain, then that defeats the purpose of the physical therapy treatment session. we can't do our job in order to help you progress in the next future physiotherapy session. So respecting the meds after surgery is totally a thing. Follow the doctor, surgeon's protocol. Follow the expectation. One will not become addicted, because when prescription medication is structured, it has to be followed by the drug administration, the Federal Drug Administration. And side note, I'll put the 5 drug schedules hyperlink in the comments. That's where I got all that information. So, it's not like the surgeon is like, oh, I'm going to prescribe 1,500 milligrams of, hydrocodone for this patient, and they have to take it 3 times a day. No, it doesn't work like that, people. So know and understand that if you sustain or undergo a surgery, and in this case, we're talking about orthopedic type deal, that taking your oral medication is a part of the healing process, and that carries over to the physical therapy session so that we can regain range of motion back, so that we can work on balance or stability, so we can work on strength, etc., right? Because we want to get you on the road to recovery as soon as possible. And in that time, if you follow the doctor, physician, surgeon's protocol, well, guess what? You'll be off that medicine faster than you ever know it. So respect the meds. Respect the medication that is a part of the healing process, because in turn, you will most likely go to physical therapy, and if you do not structure your medication dosage around the physical therapy session, or just don't even take it, the purpose of the physical therapy session will not be attained, right? You're setting yourself up for failure, because pain is inhibiting what you were able, or what the goal of that session is to accomplish. So, that's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.